So we were blindsided by that.
We're certainly very disappointed that they've chosen this action.
After 28 months of negotiations, still no deal, and unionized nurses will go out on strike again. Good evening and welcome to 22 News at 11. I'm Barry Krieger. Less than 3 hours ago, unionized nurses at Baystate Franklin Medical Center in Greenfield announced they'll go on strike after failing yet again to reach an agreement with Baystate. 22 News reporter Eugene Cho is there and joins us now from Greenfield with reaction from both sides.
Unionized nurses here at Baystate Franklin Medical Center in Greenfield will give their notice tomorrow, and they will hold their one-day strike on Monday, February 10th. This will be the second strike in the last 2 years. Since October 2011, the union and Baystate had more than 40 bargaining sessions for a new contract, but they have not been able to agree on how the nurses get paid for overtime. Last week, Baystate declared an impasse and implemented their final offer.
This has not been ratified. This has not been voted on by the nurses. This has been put upon us by Baystate. And we need to get our nurses back at the bedside, not worrying about contract negotiations.
After talking to the unionized nurses, I called the president of Baystate Regional Markets, Chuck Giganto. He told 22 News the terms the hospital implemented when they declared an impasse include a raise, a bonus, and improved benefits. He said that is the hospital's best and final offer.
We have a very strong and fair and reasonable offer on the table, and why we would put it in somebody's hands when the nurses haven't voted in this contract to us does not seem reasonable and appropriate, and so we continue to have no interest in going to arbitration.
Meantime, the nurses will continue to push for an arbitration. Giganto said the hospital does have a plan in place for the day of the strike, and he promised services will not be disrupted on February 10th. Live in Greenfield, Eugene Cho, 22 News.